Hi, I'm Robert Moxley, and today we're going to be looking at the actions that President Biden has taken so far. Biden came out of the gate swinging with executive actions and mandates and the like, and I think it's important that we all stay as informed as possible, but with the amount of information constantly happening every day, it can be hard to keep up with this information. So, to that end, one of my friends started writing out summaries, and I figured I'd put them in video form for people who are even more on the go than that, or who just want a good reference. We'll also be linking in the description the direct information, so if anything catches your eye while we're looking over what's done so far, then that's where you'll be able to find more information on it. These will be coming directly from the White House press briefings. This is all publicly available information, just wanted to make it more accessible and easy to consume. So these are small summaries. With that, let's go. Today we'll be covering Thursday, January 21st, the first full day of Biden's presidency. We'll be starting off with the executive order on promoting COVID-19 safety in domestic and international travel. This executive order requires masks in public transportation and requires the relevant organizations to take immediate action in line with local laws. It also provides support from government agencies to organizations to better allow action to be taken against anyone not wearing a mask on public transit, and it requires a negative COVID test to enter the U.S. from a foreign country. Next up is the executive order on improving and expanding access to care and treatments for COVID-19. This one will primarily push the HHS and the NIH to do the following. Develop a plan to support and fund additional tests and large-scale studies for COVID treatments and long-term effects, provide recommendations to increase healthcare workforces, expand access to long-term care for recovering patients, create a plan to better push out existing treatments, evaluate the COVID-19 uninsured program to make it easy to use and accessible to anyone without insurance, and evaluate insurance plans and promote the coverage of COVID treatments. Third, we have the executive order on ensuring a data-driven response to COVID-19 and future high-consequence public health threats. This does two primary things. First, the heads of relevant agencies are to pick a senior official to work with the President's COVID-19 response coordinator to serve as that agency's COVID lead and coordinate data. Second, it pushes for a plan to innovate public health analytics. Next, we have the memorandum to extend federal support to governors' use of the National Guard to respond to COVID-19 and to increase reimbursement and other assistance provided to states. That one was a long one. This does what it sounds like. It supports governors calling in the National Guard and FEMA for COVID-related responses, and it reimburses states for the cost of that assistance. We also have the executive order on a sustainable public health supply chain. This does three things. It creates the COVID-19 Health Equity Task Force. It focuses on the disproportionate impact of COVID on communities based on race, ethnicity, and other factors to the extent permitted by law, and directs relevant agencies to use this data to better provide care where it is needed. Next, we have the executive order on supporting the reopening and continuing operation of schools and early childhood education providers. Here, the Secretary of Education is directed to work with the Secretary of HHS to create a plan for safe school reopening. It develops stronger means for schools and higher learning to collaborate on best practices, directs a report from the Department of Education in the disparate impact of COVID on minority-serving institutions. It also ensures that schools are provided necessary supplies such as testing materials. In addition to all of that, it will also support the development of contact tracing programs at schools to the maximum extent possible, and it pushes the FCC to increase connectivity options for students without reliable internet. We're almost there. Next to last, we have the executive order on protecting worker health and safety. This will use the Occupational Safety and Health Act to do the following. It will create new guidelines for safety, consider and issue any needed emergency standards, better enforce COVID-related OSHA violations, engage with labor unions and other organizations to make sure workers know their rights related to COVID exposure. And additionally, it pushes relevant agencies to create better protections for workers in the public sector. And finally, we have the executive order on establishing the COVID-19 Pandemic Testing Board and ensuring a sustainable public health workforce for COVID-19 and other biological threats. That one was egregious. So this one's pretty big. It creates a board to coordinate federal testing efforts, expand equitable access to tests, and facilitate free COVID testing for those without comprehensive insurance. It also will provide support for surveillance testing in schools, establishes a public health workforce program to provide additional support to health agencies in respect to testing, contact tracing, and mass vaccination. It also pushes for a plan to create the U.S. Public Health Job Corps, to be either modeled on or created under FEMA to provide assistance to healthcare agencies. This organization will assist in tracing vaccinations and also run training programs to get more workers available. All right, that's it for the presidential actions taken on Thursday, January 21st. Let us know what you think about them, and let us know if we missed anything or we need more or less detail. This was, again, really just meant to be a quick reference guide, a quick and easy way to stay informed. Please like, share, subscribe, do all the things, you know. How do you end videos? Analytics.